This segment of Delmarva Life is brought to you by Delmarva Dental Services.
You know what comes to mind when talking about bad habits? Nail biting.
Oof.
Yeah, I'm guilty of it. And it's a habit that can really mess up your teeth.
Yeah, and that's not the only thing that people are doing that can mess up their chompers. Delmarva Life Sean Stryker recently paid a visit to Delmarva Dental Services to find out some of the other harmful dental habits that you need to kick.
Biting your nails and chewing on a pen. They're things you know you shouldn't do, but a lot of you do it anyway.
We see it all the time. People don't even realize that they have these habits, or more importantly, they don't realize how detrimental some of these habits can be.
Dr. Leigh Auchey with Delmarva Dental Services says they're habits you should kick, and the sooner, the better.
The habits can be really hard to quit, but they can also cause a lot of cumulative effects. So the sooner that we can get someone to realize what they're doing and actually make a change to stop or work towards changing those habits, the better off they're going to be long term.
Take nail biting, for instance. Dr. Auchey says it's very common with both children and adults.
A lot of people bite their nails, and we'll see crack lines in the front teeth. The edges of the front teeth are really worn down, top and bottom.
Dr. Auchey says even something as innocent as using your teeth to open a snack can cause damage. And let's not forget about chewing ice.
People who chew ice usually do it a lot. You can actually break fillings, you can break crowns, you can break natural teeth. Many times restorable, but in some cases it's bad enough that we can't save the tooth.
And we've all heard how bad sugary drinks can be for your body, but they're also bad for your teeth.
I think, unfortunately, a lot of kids, in particular teenagers, sports players, they drink a lot of energy-type drinks or sports drinks. The acidity and the sugar that is contained in those is really incredible, and I don't think people realize how bad that is. So we see a lot of what we call sipping decay, which tends to be cavities that we see right at the gum line areas around the teeth. We can also see erosion of the teeth from those kind of products and drinks.
While these habits can be kicked with a little willpower, others can be a little more difficult because you might not know you're doing it.
Most patients don't know that they have a grinding or clenching habit. So when we ask them those questions at their first exam or somewhere else down the line, they'll say, not that I'm aware of. But we can see evidence on their teeth that they are in fact doing something. We will see wearing down of the teeth. You can also actually cause fractures of the teeth by the intensity that you grind or clench.
This can even cause pain in your jaw. Luckily, there are different types of guards that can help.
We have everything from guards that help to reposition the lower jaw forward to softer type guards that are more like an athletic guard, but just kind of almost like shocks for your teeth. So it just cushions in between the upper and lower teeth.
Now you would think one thing that wouldn't harm your teeth would be brushing them. But Dr. Auchey says that's not always the case, especially if you're using an abrasive toothpaste.
You can actually feel them if you put different toothpaste in between your fingers and kind of roll it around. Some of them will feel very gritty. Some of them are very smooth. Some of them are more like a gel or a paste. Lots of differences. Once you start to use those, a lot of people can also be kind of heavy-handed. So it's the abrasiveness of the toothpaste plus the brushing technique or the type of toothbrush you're using. But we see a lot of wear, especially at the gum lines, again, from that kind of habit where you think you're doing a good job, you think you're doing the right thing.
If you're guilty of some or all of these bad habits, Dr. Auchey says the first step in kicking them is becoming aware that you're doing them in the first place.
Most of the time, people may not realize that what they're doing is so significant, and most of the time, people are very willing to try to make a change once we make them aware of the problem and educate them on how we can get things better.
Now, if that little tidbit about abrasive toothpaste surprised you and you'd like to find out which toothpaste to avoid, you can visit our website, WBOC.com, and click on our picture at the top of the page.
It's pretty interesting.